Do I have carpal tunnel or arthritis?
I realize both can seem interchangeable at times, since they make moving your fingers hurt and seem eased by pain relievers. However, they are different health conditions.
Yes, but how do I tell the difference?
Carpal tunnel syndrome is a repetitive stress injury. You know you do not have arthritis when changing your routine, like switching to voice dictation, doing other tasks in between to break up the repetition, or getting ergonomic tools makes it go away.
Arthritis can make your hands hurt when you type or cook too.
Arthritis may be caused by an autoimmune attack on the joints, destruction of the cartilage, or other reasons. You know you have arthritis when the joints balloon up and feel hot.
I remember my grandmother's hands looking like walnuts on little strings, but the swelling like that I thought was only in the autoimmune version of the disease.
If you have carpal tunnel syndrome, the joints hurt but do not swell externally. It is internal swelling that causes the numbness and tingling you feel because of pressure on the nerve, and arthritis does not cause those symptoms either.
What does arthritis in the hands do?
You get swelling, warmth and tenderness to the touch, and if untreated, deformities in the finger joints.
Have you seen carpal tunnel surgery scars?
But that deformity is only after the surgery, whereas carpal tunnel only makes it hard to use the hands due to numbness and pain. Arthritis causes deformity whether you do nothing or not, well, if you do nothing to treat it.
How are they treated?
Arthritis is treated with anti-inflammatory meds and pain relievers.
So is carpal tunnel syndrome.
Arthritis is often accompanied by morning stiffness, sometimes in large parts of the body, whereas carpal tunnel syndrome is not going to migrate up the elbow or shoulder. And arthritis causes joint stiffness before pain, whereas carpal tunnel just hurts to move.
Assuming the nerve is not so compressed you can't.
It would be numb but not unable to move. With arthritis, particularly rheumatoid arthritis, you can't move the affected fingers though the feeling is fine.
So carpal tunnel affects the nerves, while arthritis affects the joints.
Another difference between arthritis and carpal tunnel syndrome, assuming the arthritis is not triggered by a severe injury, is that arthritis is in the joints equally, like both hands. It is rare for both hands to have carpal tunnel syndrome equally.
So if it is mostly the hand I use the most, it is probably carpal tunnel syndrome.
But regardless of what you think you have, see a doctor so you do not have it get worse and lose partial use of the hands.